The strategy, the difficulties really lie in number one, the rarity of these diseases. Number two, the aggressive nature of these diseases, because while the incidence of CMML is not so drastically different than, say, polycythemia vera, the prevalence is very different, and that's because unfortunately patients with CMML have a far shorter survival. So that's a big factor. And then lastly, just the notion that these are overlap syndromes, that they're difficult to diagnose in and of itself. And there's been historically a change in how we classify it as a subtype of MDS to its own entity. And all of that has led to some sort of confusion in terms of how we diagnose it, how rare it is. But I think things are changing now. I think, with new response criteria, with renewed interest from industry, recognizing that it is an area of unmet need, and with a scientific community that's now focused more on CMML, I think we're all hopeful that that's going to change.